Malaysia has confirmed its first citizen to be affected. The country has now 10 confirmed cases. Melissa Go is in Kuala Lumpur with the details. Now, Mel, what do we know about Malaysia's first citizen case of the novel coronavirus?
Well, it's still unclear how this 41-year-old Malaysian man caught the virus. Investigation is still ongoing. Malaysian Minister of Health, Dr. Zulkifli Ahmad, said it's best not to speculate at this juncture. But from the preliminary findings, he travelled to Singapore on January 16 for a week to attend an international conference where there were at least 10 delegates, we were told, from mainland China, including one from Wuhan. Now, he came back to Malaysia on January 23rd, just before Chinese New Year, so in time to spend New Year with his family. Now, at first he was okay, and later he started to feel unwell. He went to local clinics before he decided to seek treatment at a private hospital in Selangor. Now, on January 29, that was a week ago, when he developed cough and fever. Then on February 2nd, he admitted to the hospital in Sungai Buloh, one of the 26 designated government hospitals, and his oral swab was taken for tests at the lab in Sungai Buloh, and it's confirmed positive of the virus on February 3rd. Now, contact tracing has already begun. Health Minister said Malaysia is working closely with officials from neighbouring Singapore to do that. Best not to speculate at this moment. As of now, 10 confirmed cases reported in Malaysia. 9 are Chinese nationals from Wuhan who caught the virus in their home country, while the only Malaysian, the 41-year-old man, they believe could have caught outside the country from neighbouring Singapore. So this isn't a local transmission as we speak.
Mel, Malaysia has evacuated some of its citizens from Wuhan this morning. 2 of those citizens showed symptoms. How can authorities there step up measures now to prevent any new cases or possible infections from occurring?
Well, the 2, they are currently isolated and being treated at the General Hospital in Kuala Lumpur. Their samples also been taken for testing at one of the 3 labs in Malaysia. The result will be known by tomorrow. Now, the rest 105 passengers who arrived from Wuhan this morning are being quarantined at an academy outside Kuala Lumpur in Nilai, Seremban, about an hour from here. Now, it's been turned into sort of a temporary surveillance centre. Now, authorities in Malaysia are stepping up preparations, especially with no end in sight with the outbreak in China and the rapid spread. Now, 10 confirmed cases, as I mentioned, more than 300 cases being investigated, including contact tracing here. It's a non-stop operation involving many agencies, not just the health authorities. Now, here at Kuala Lumpur International Airport, more than 300 cleaners are spraying, wiping and sanitizing twice a day, making sure that the trolleys, the handrail, the lift buttons, everything, the tabletops and so on, are free from the new coronavirus. Now, from the Director of Communicable Disease I spoke with, Dr. Chong Chi Kyong, he's waiting for more materials to arrive to enable more hospitals, more labs to test the virus, because right now, he said, there's a shortage of everything worldwide. Certainly, the government is relieved that there hasn't been a confirmed local transmission here yet in Malaysia, and authorities are hoping to keep it that way.
Mel, thank you very much for that update. That was Melissa Go there reporting for us from Kuala Lumpur.